I want to blank if it's okay with my care provider. This is one of those statements that when clients come to me and speak about it, it absolutely makes my heart stop. The if I'm allowed. The reason for this is because in modern society and with Western medicine, it's becoming more and more common that people are feeling that their care providers are actually the authority over their own personal body, and they feel that they have to ask permission in order to birth the way that they want to. Unfortunately, I'm seeing this more and more and more as a doula, and I'm seeing it a lot with COVID and with everything that's going on because you're having less support that's able to come with you into the birthing room, and it's just kind of getting out of control. So that's the biggest reason for this video. I just want to try to encourage people to take back the control and take back the power of your birth. Obviously, there will be medical situations where it will be medically necessary, and I'm not saying to not listen to your care providers. That's absolutely not what I'm saying here. But what I am saying is that you do have power, you do have intuition. This is still your body, and you don't always have to comply. You can ask questions and make sure that you're making an informed decision that is not based out of fear and out of feeling like you have to comply, but actually coming from a place of actual information and making an informed decision. So just to give you an idea of what I'm talking about, let's picture a VBAC client. Mary wants to have a VBAC, so she wants to have a vaginal birth after cesarean, and she knows deep in her gut that she is capable of doing this. This is something that she knows she can do. She knows that her body was made to do this. She feels confident. However, she's feeling a lot of pressure, and she's feeling like she's wrestling with this information that she's been provided by her obstetrician, because she's feeling that if she questions the advice, or if she questions that she's considered high risk, that she is looking like she is not taking her pregnancy seriously. So these feelings of guilt, these feelings of fear, of compliance, leaves Mary in a situation where she feels like she has to go along with the plan without asking questions. This is not informed consent. So with this example of Mary, while she's wrestling with the permission to be able to birth the way that she wants to, if there's no medical need for it, and if it's just out of protocols, then you need to consider that this is a line. We are being put into this little cookie cutter society that every birth and every delivery is supposed to be the exact same. Every pregnancy is supposed to be the same. And if it's not, then you're considered high risk. And that isn't the way it's supposed to be. Mary is wrestling with those ideas of if she actually gets the induction, then she has to go into the hospital and she's going to have continuous monitoring, which is going to restrict her movement. These are those types of interventions. She knows now with the information that she's been provided that if she gets the epidural, that she's going to not be able to be in an upright position, but she's going to be more restricted and having to be only rolling from one side to the other side, which isn't the way that she wants to birth. So this is one of those things where, is this actually medically necessary? And what can you do to take some of that power back if it's not necessary? And if you actually want to basically pull in those reins and take power back for your birth. Make sure that you are aware that you are hiring your healthcare professional. So if you're in Canada, OHIP covers that. However, you don't have to go with who you have. You can try to hire somebody else. Make sure that you know what your birthing rights are so that you don't get persuaded into a situation that you're uncomfortable with. Make sure that you have a health professional or a doula or good encouragement, somebody that will help to advocate for you in the birth that you want. And make sure that your care provider knows what your birthing preferences are so that you can move forward together in that avenue. If this video is speaking to you and you are feeling concerned about falling victim into the categories of being bullied into things that you don't want to do, consider your environment. If you are birthing with a midwife, then you have the ability to birth at a birth center or to birth at home. Go somewhere that you feel comfortable, where you feel like your decisions are going to be respected and your birth outcome is going to be more reflected of empowerment, is going to be something that you look back on and you feel like you are a part of the process. Birth is an extremely transformative experience. This isn't something that you want to just be submissive to. You don't want to feel oppressed. You want to feel encouraged. You want to feel like you've been a part of the journey, that you've been a part of the experience, that you've made informed decisions, and that you are supported in a way that leaves you feeling empowered. My name is Meg Davey, and if this video sparked anything in you, and if you're wanting to learn more, then feel free to check out my website. It'll be linked below. I also have a lot of free content on my YouTube channel, and you can check out my coaching packages on my website.